We tend to think of a chest x-ray as, well, a pretty standard, maybe even simple medical test, right? But what if I told you that reading one is actually some brilliant detective work? Today, we're going to dive into the clever techniques and some surprising physics that doctors use to solve medical mysteries, all with just a single beam of light. All right, so this is the goal. This is what we're aiming for, the perfect picture. It's called a PA view, that stands for posterior anterior, and it's really the gold standard for getting the clearest, sharpest look inside the chest. But as you're about to see, getting a shot this good is way more deliberate than you might think. But that's the real question, isn't it? What happens when getting that ideal shot just isn't an option? When a patient is too sick to stand or when the clues you're looking for are hiding in plain sight. Well, that's when the real detective work kicks in.
So first things first, let's break down what makes that standard image so perfect in the first place. And believe it or not, it all comes down to some surprisingly simple physics.
So for that standard PA view, the X-ray machine is placed a full 6 feet away from the patient. And that distance, it's absolutely key. The beam travels from back to front, posterior to anterior, while the patient stands up nice and straight and takes a big, deep breath.
Now, why 6 feet? Well, the reason for that distance is actually best explained with a super simple analogy. Think about making hand shadows. When your hand is close to the light, its shadow is big and kind of blurry, right? But as you move your hand closer to the wall, that shadow gets smaller and way sharper. It is the exact same principle with an X-ray. More distance equals a sharper image. Okay, but let's look at our first case. We've got a patient who just can't stand up for that perfect picture. So what's the workaround? What do you do when you have to bring the X-ray machine right to the patient's bedside? This is where you use a portable machine to take what's called an AP view, anterior-posterior. But, and this is a big but, it's a compromise. The machine is closer, which means everything gets magnified, and the image is just less sharp. And because your heart is at the front of your chest, an anterior structure, that magnification makes it look artificially large. And that, as you can imagine, can sometimes be pretty misleading. And this slide just illustrates the difference perfectly. These are two X-rays of the very same patient. Now, just look at the one on the right for a second. See how the heart silhouette looks wider? And the edges of the lungs and ribs, they seem just a little bit fuzzier, don't they? That right there is the AP view in action. So, okay, quick pop quiz for you. Based on what we've just talked about, which one is the gold standard PA view? If you said the one on the left, you are absolutely right. See? You're already starting to think like a radiologist. All right, let's move on to our next case and see how this all builds. Because sometimes the problem isn't the quality of the image, it's the angle. A disease can literally be hiding completely invisible from the front. Just take a look at this X-ray. I mean, at first glance, it looks pretty normal, doesn't it? But I'm going to tell you right now, there is a serious case of pneumonia lurking in this image. The problem? It's hiding directly behind the heart. And here's the big reveal. By taking a second picture, this time from the side, what we call a lateral view, the hidden clue becomes totally obvious. See that white patch the arrow's pointing to, right there over the spine? That's the pneumonia. It was there the whole time. It is a perfect example of why a second perspective can be so crucial. Okay, so to get our heads around the next few tricks, we need a quick primer on density. The basic rule is actually really simple. The more radiation something absorbs, the whiter it looks on the film. So air is black, soft tissue and fluid are gray, and really dense things like bone or metal, they show up as bright white. And speaking of density, let's take a quick and kind of weird detour to really make this concept stick. Any guesses what these are? They're Beanie Babies. Seriously, you can see their less dense fabric outline, but all those thousands of tiny plastic pellets inside, they're much denser, so they show up as this speckled white pattern. It's just a fun, weird way to remember how different materials look on an X-ray. All right, now for what I think are the most ingenious techniques. This is where doctors literally use gravity as a diagnostic tool. I mean, these are some truly clever hacks. Okay, look at this X-ray. The diaphragm on the left side, it looks a little too high, doesn't it? That's a really subtle clue that something's not right. The suspicion here is that there's a pocket of fluid, it's called a pleural effusion, trapped between the lung and the diaphragm, and it's pushing it up. But how do you prove it? Well, the solution is incredibly simple, and frankly, it's kind of genius. You just have the patient lie down on their side. And voila, this is what's called a decubitus view. Gravity does all the work. It pulls the fluid out from under the lung and lets it layer out along the ribs, creating that super obvious white line. The hidden fluid is now in plain sight, mystery solved. But what's really amazing is that this trick also works in reverse. So let's say a doctor suspects there's trapped air in the chest, a condition called a pneumothorax. Now, instead of heavy fluid, they're looking for light air. So what do? They have the patient lie on their opposite side. Gravity is still the tool, but this time, instead of pulling fluid down, it allows the lighter air to rise. And this creates a clear, black pocket at the very top of the chest that's way easier to spot. All right, for our final twist, we're going to look at how something as simple as taking a breath, or, not taking one, can completely change the entire story. So over on the left, we've got a standard X-ray. It's taken on a deep breath in. The lungs are full of air. Everything is nice and spread out. Now, look at the right. This is the exact same person, but this time after breathing out. Just notice how the lungs look crowded and wider, and the heart suddenly looks so much bigger. Now, a poorly timed X-ray, one taken when the patient is breathing out, can sometimes look like there's a disease, causing a false alarm. But, and here's the twist, doctors can intentionally order an expiratory X-ray because it can reveal a problem that you just can't see otherwise. And this leads us to a really brilliant clinical pearl. Imagine a little kid inhales a small object, say a peanut, and it gets stuck, blocking one of their airways. On a normal X-ray, you probably wouldn't see a thing. But if you hear a wheeze on just one side, you can order one of these expiratory films. What happens is the healthy lung will deflate and turn gray, but the blocked lung, it stays full of trapped air, so it stays black, making the location of that foreign object totally obvious. So a bad picture actually becomes the key to solving the entire case. And that kind of leaves us with one final thought, doesn't it? How many other simple principles are hiding complex solutions right in front of our eyes?